Assalamualaikum warahmatullahi ta'ala wabarakatuh and a very good morning everyone. The title of my presentation for today is The Development of the Malay Version of the English HIV Stigma Questionnaire, a Review. I would like to acknowledge all the co-authors for this paper published in 2020. HIV stigma is a set of negative attitude and belief towards people living with HIV, PL-HIV. HIV stigma has imposed threats to the physical well-being and also the mental health of these peoples. Also, HIV stigma can impede the screening program, treatment, and also compliance towards HIV/AIDS management. Therefore, eliminating and reducing HIV stigma is a potent strategy in eliminating HIV/AIDS infection. The evidence-based decision-making were needed. Therefore, the data on the burden of HIV stigma in Malaysia is vital. The Global Stigma and Discrimination Indicator Working Group and Strive Research Consortium has established a HIV stigma questionnaire, which consists of 6 domains that identify based on the previous research and also systematic review. As one of the ultimate standard of HIV stigma index, we are actually embarking this questionnaire towards our general population. Thus, the Malay language standardized questionnaire of HIV stigma need to be developed. So the objective of this study is to examine the cross-cultural translation adaptation of the Malay version of HIV stigma questionnaire and also examine its validity and also its reliability. There are 6 key conceptual domains from this questionnaire, which is the anticipated stigma, the perceived stigma, the fear of HIV infection, the social judgment, the experienced stigma, and also the discrimination stigma, which has been illustrated in this slide. So we come towards the methodology of this study. So the first step towards validations of this questionnaire is via the forward-backward translation. The initial translation from the original English version towards the Malay language been done by the 3 independent translators. All the 3 translators are bilingual, English and Malay language, with 2 of them are the Malay language have the Malay language mother's tongue. The first translators was a researcher who are aware of the concept and the questionnaire that intend to be measured, and the other 2 translators who are the layman translator who are not aware of the objective of the question, and all these translators has been analyzed whereby the discrepancies between those 3 translators were discussed with the consensus need to be provided at the end of the session. The initial translation of forward translation was again back translate from the Malay language to the English language to ensure the accuracy of the translation. The backward translation was performed by the same 3 translators, and again, all the discrepancy between the 3 translators was analyzed and discussed to reach the consensus. The second step is in terms of content validations. So there is a group of expert committees represented by the HIV/AIDS sectors, MOH, public health specialists, and also the researchers in this area. They have reviewed the forward-backward translation and whether the translated and the original version achieve the semantics, idiomatics, and also experiential and conceptual equivalence. These expert committees has discussed it in thorough, and all the discrepancy that need to be resolved is then again be discussed to reach a consensus. Therefore, after the content validation process is completed, the questionnaire are ready for preliminary pilot testing. The pilot testing was done involving 36 respondents from the various socio-economic background. A cognitive interview was done to gain information on what they thought of each questionnaire item and their response towards each item. After completed the preliminary pilot testing, the data has been analyzed to determine the reliability index. And via this study, we are determining the reliability levels via the internal consistency, whereby the Cronbach alpha analysis was done. And we are happy to report that this questionnaire has yielded the Cronbach alpha of 0.76. So the translated version of the HIV stigma questionnaire, Malay version, has been done. And for the conclusion, this is the first validation study of the Malay version of HIV stigma questionnaire. And the overall finding has shown that these versions has been culturally accepted, with the content validity and reliability levels was excellent. Hence, the Malay version of questionnaire are embarked on the larger National Health Survey, in example for the National Health and Morbidity Survey 2020. So by that, I thank you.